I'm Dr. John Mark Wesley. I'm one of the vascular surgeons here at Vascular Specialists of Central Florida. I was born and raised in Delray Beach, Florida, which is a small city in southeast Florida. I am one of 6 children. Both of my parents are educators who were raised in a very loving environment. My hobbies as a kid included all activities, including sports. My father was a band director and music teacher, and so at a very early age I learned how to play the trumpet and quickly flourished at that activity. Left Delray Beach in 1985 to go to college in Hampton, Virginia, where I majored in biology. I then went to the University of Miami for medical school, and in 1993 went to Howard University Hospital for general surgery training. In the middle of my residency training, I did 2 years of intensive research on cardiac transplant immunology at the National Institutes of Health. I then went on to do a fellowship in vascular surgery at the University of Wisconsin, after which I spent a year in practice and then moved to Orlando, where I've been since. Vascular surgery is a subspecialty of general surgery. I really enjoyed most aspects of general surgery, but in particular, I loved vascular surgery, largely because of the patient population that I treated and because of the innovation that was involved in the management of vascular patients. I found that vascular surgery as a specialty was one of the few specialties in general surgery that allowed me to manage my patients comprehensively through physical therapy, medicine, minimally invasive surgical treatments, as well as major surgical treatments. It also is one of the few surgical specialties where continuity of care is more of the rule than the exception. It is probably one of the biggest reasons why I enjoyed vascular surgery most. I believe that many skills are important to be an excellent vascular surgeon. Clearly, technical skills, intellectual skills are very important. But the skill that stands out most in my mind, that I believe aids me most, is the skill of empathy. Having had to deal with illness in my own family, I believe that equips me to truly understand what patients and their families go through. I believe that allows me to make far more objective decisions when it comes to how I manage patients. I believe what stands out most at Vascular Specialists of Central Florida is a sense of teamwork, and this permeates throughout the entire practice, from the surgeons to the nurses to the techs to the secretaries. Everyone here has a sense of single purpose, and that is taking good care of our patients. And you can feel it when you walk in the front door, when you're taken back to the exam room, when you have your ultrasound studies. When you leave out of the front door, you have this sense that everyone there has really been there to take good care of you. What I enjoy most about being a doctor is the privilege that people bestow upon me to help them through one of the most difficult times anyone can go through, and that is when their health is being challenged. I find that the most humbling experience, and I'm very honored by the opportunity to take care of patients under those circumstances. I take that so seriously. There are many other aspects about being a doctor that I really enjoy. I enjoy research, presentations. I love educating residents and medical students to do some of the things that I've learned to do in my lifetime. I find the education of medical students and residents to be very, very important. These future physicians will be very critical to the passing of the torch, if you will, of the management of patients in the future. I believe that they can either be educated well or educated poorly, so I take it very personally to try to educate them well. We take great pride in having those students and interns and residents involved with us, both in the office and in the hospital, so that we can help guide them through this very important process. The conditions that we treat here at Vascular Specialists are some of the most complex conditions to treat. It therefore makes the process of being seen, being evaluated, and being well taken care of sometimes seem very complex. Clearly, my primary objective when patients walk through the doors is to make sure that they leave my practice whole, more healthy than they were when they walked in. But I really want them to walk out of here with a sense that everyone here had their best interest at heart.